Hello, everyone. Dr. Tony Scuderi here again with my next installment of a class for you. I have a handout, it's a PowerPoint presentation that will be attached to your inbox or your Moodle email or however you'll see it. It goes along with this. The topic today is going to be on codependency and how does it really, or what does it really mean, and how is it treated? I want to introduce you to a couple really, really good resources for you. The author is Melanie Beattie, and her first book that she had is called Codependent No More. I just moved here so you can see it. It's called How to Stop Controlling Others and Start Controlling Yourself. This has been on the market for quite some time, but it's a classic. It's a very good book. I would strongly suggest that you put it into your library. That's your first one. The second one was this. It is called Beyond Codependency and Getting Better All the Time. That's a very young Melanie Beattie. Again, another book for you to put on your bookshelf. It's a really good one. All right, let me start. Codependency. To start off with, I think that we need to understand that most of us in the clinic setting counselors use this term all the time. And I've always wondered, do we really understand what it means? Most people just use it and they have no concept of what it is. It can be defined in many, many different ways. We want to take a look at the meaning of codependency. So there are a couple things. Robert Stubby, Subby, says that it is an emotional, psychological, and behavioral condition that develops as a result of an individual's prolonged exposure to and practice of a set of oppressive rules, rules which prevent open expression of feelings as well as the direct discussion of personal and interpersonal problems. Another person, Ernie Larson, describes codependency as those self-defeating learned behaviors of character defects that result in a diminished capacity to initiate or to participate in loving relationships. And other people would define it as I'm a caretaker, or it means that I'm married to an alcoholic, or I need to go to Al-Anon, or codependency means I'm up to my elbows in alcoholics, and codependency means knowing all your relationships will either go and on the same way painfully or end the same way destructively, or both. These are some definitions. Which one's correct? Basically, they're all correct. But we need to just take those many things and pull them in and understand that a codependent person is a person who lets another person how can I put this? Another person's behavior allows another person's behavior to affect them in some way. They're obsessed with controlling another person's behavior. It prevents that person from open expressions, from feelings, as well as direct discussion of personal as well as interpersonal problems. So we see in a codependent person that when we interact with somebody else, they got to control. They're control freaks, um, and that's an issue. I mean, we see so many people that need to control other people because of the things that they do, the way that they do things, and why they do it. Is it a disease? Because we call it alcoholism and drug addiction is a brain disease. But we say that codependency is a disease because I don't really see it that well addressed in the DSM-5 or 4 or 3 or any of them. Because this came out back in the 70s and it's been ongoing. Codependency is listed in the literature, psychiatry literature, psychology literature, addictions literature, marriage and family literature is a big thing there. But it's mentioned, it's talked about, but is it a disease? Well, Some will sit there and say that it is a disease. It is a progressive and it is a chronic disease. Some say that codependents want and need sick people around them to be happy in an unhealthy way. Um, there's a condition, a very bad condition. It's called Munchausen by proxy. Now, Munchausen by proxy is a diagnostic category. It's a mental health problem in which caregivers, parents, grandparents, whoever takes care of the child, makes up a cause or an illness or an injury in a person under their care, so that the child, or an elderly adult or a person who has a disability because they're vulnerable people, are victims. Munchausen by syndrome or Munchausen syndrome by proxy is a form of child abuse and a form of elder abuse. It's a mental issue. It's a form of child abuse. The caretaker of the child, most often, it's usually the mother. Sometimes it could be very rare cases the father, but usually the mother or the grandmother either makes up a false symptom or causes a real symptom that causes the child to have some issues and some problems. I've seen cases of Munchausen by proxy where the mother or the caretaker turns around and goes to the doctor and insists that there's something wrong with the child and they need surgery. So the child has surgery after surgery after surgery. Um, don't ask me how that happens. Does the doctor do an examination? Does the doctor sit there and say, well, there's nothing wrong with your child? Um, I don't know. I honestly don't know. But what I do know is when it comes to Munchausen by proxy, this happens a lot. Or on other times, the parent, the caretaker, will sit there with the child and say, "No, you can't go to school. Oh my gosh, my kid is sick. They got to stay home." They'll come up with an illness, or they'll convince the child that the child has an illness, and they'll have that child act out that illness in some way, shape, or form. One of the biggest problems with Munchausen by proxy is it gets very costly. This could be seen that the parents are constantly going to the doctor, constantly getting surgeries. Insurance companies are being charged tremendous amounts of money for diagnoses that are not real. So codependency. Let's go back to that. Could codependency fit into Munchausen by proxy? I think it could. I really think it could, because what's happening with codependency is people are trying to cause people to get sicker. The sicker they are, the better it is for them, right? One of the other issues with codependency and this Munchausen by proxy thing, why do people want to keep people sick? It could be financial issues. It could be, all kinds of things. There's a thing called malingering. A malingering patient is a patient that says that they are sick and feigns the sickness just to get money. So one of the issues of that diagnosis is that the patient. One of the criteria for the diagnosis is the patient would have to fake an illness for the sake of getting money. Well, in codependency, it's not the idea of faking an illness because the person is already ill, but the family member has to keep them sick. And part of that could be they're not looking at their own stuff. Remember, I talked about, if you've been watching my videos here, the identified patient, and how I said the identified patient carries the pathology of the family. Well, in codependency, that's what's happening. The pathological patient, the drug addict or the alcoholic, all right, is symptomatic. And the symptoms are there not only because of the alcoholism and the drug addiction, but because the family's pushing them in that direction, in that area. They're not doing anything to try to get them off drugs. They may say they are, but the moment that person comes off drugs, or the moment they go into recovery, the family starts to spiral down. When the family starts to spiral down, then the pathology of the family starts to come out. And as that pathology comes out, we now see codependency acted out. So, it's the whole idea of protection versus reaction, right? So, what am I talking about when I say protection versus reaction? Well, for one thing, protection is a natural state. We all of us want to protect somebody, either ourselves or somebody else, or we want to just protect the whole world. It doesn't have to be pathological. It's more instinctual to protect. We protect children, right? It's instinctual. The greatest, the greater the problem, the more protective we become, right? Bullying is a good example of this. Kids get bullied. When I was in grade school, I was bullied. I used to be the street punching bag. People would come up, the kids would come up and just beat the living daylights out of me. And then when I would go home, and tell my dad what happened, I get it from him as well, right? Because that's just the way things were back then. If you don't defend yourself, you're not a man. Even if you do defend yourself and you get beat up because you got beat up, you're not a man. That's crazy. Lunacy, if you ask me. But that's part of the problem. So people try to protect, right? Couple instances. Some of my friends got in there, and it was a brawl. People were picking on me. They came in, et cetera, et cetera, et cetera. Well, in families, it's the same thing. It can also be a reaction. However, it's a different type of reaction to what we're seeing. Reactionism is a little bit different when it comes to codependency. Codependency is indeed a reactionary process as opposed to a protective process. All right. Codependents don't protect. Codependents react to an illness. All right. So they overreact or they underreact. Sometimes codependents rarely act. They just let it happen because the sicker the patient is, the better it is for the codependent. Right. So the reactions, are a response to the stress, to the uncertainty of living or growing up with an alcoholic in the family or a drug addict in the family. Some other issues that may arise, they don't know what to do to protect these people, to protect themselves, or even how to help this person. Because sometimes with codependency, they think that they're actually helping the individual, when in actuality, they're getting the individual even sicker. So let me go back a little bit to codependency as a disease. All right. It's progressive, just like alcoholism and just like drug addiction. It's progressive. People around us become sick and they become sicker. We react to that sickness more intensely. A little concern builds into the out of control response of the person, the identified non codependent person, right? Because you got two of them. You got the codependent one, you got the non identified patient, which really carries pathology, right? So through interactions with the codependent, they may respond with increased depression. They may respond with increased emotional or physical illness. They may respond with suicidal features. They could be a borderline, but they're responding because what they want is they want the pathological person to get even sicker. The sicker they are, the better it is for them. This is a real bad disease as far as I'm concerned. Codependent thoughts and behaviors are very self-destructive, as we know, right? Their thoughts can be self-sabotaging. They usually sabotage relationships. This sounds a whole heck of a lot like a borderline. Take a look at Marsha Linehan's work. You'll see this coming out very clear. And this, by the way, was before Marsha Linehan, right? Codependent behaviors are and the thoughts that are associated with these behaviors can be self-absorbing, and it can also be absorbing relationships and sabotaging those relationships. All right. They find peace and happiness, which is most important with codependence, because the sicker the person is, the happier they are. So to change the codependent behaviors, the individual that is the non-patient, right, has to work on changing themselves first. If they can't change themselves, they can't recognize what they're doing, they're going to get sicker and sicker and sicker, right? So we can't change the other person. That codependent has to change themselves. It's a power greater than themselves, codependency is, that can lead them to insanity. Step one, alcohol is a power greater than ourselves that can lead us to insanity. Well, yeah, it is a power greater than themselves that can lead them to insanity as well. So let's take a look at some symptoms of codependence. I want to read some of these to you. Okay. The symptoms of codependency. It's an inability to know what normal is, difficulty to follow a project through, difficulty having fun, judging self others without mercy, low self esteem, often projected onto others. In other words, for example, why don't they get their act together? This is what they'll turn around and say. Overreacting to change or intense fear, that happens sometimes with it. Inability to deal with change, constantly seeking approval or affirmation, compromising a sense of self. So they will compromise themselves to keep the person sick. Feelings of being different, confusion, self inadequacy. These are just some symptoms of codependency. There are many, many others that you'll see in your handout. Characteristics. Now, a codependent caretaker has characteristics. So when you're in treatment, not when you're in treatment, when you're in the treatment facility, and you notice somebody with these characteristics, a red light should go on. So some characteristics of codependent caretaking include the following. My good feelings about who I am stems from being liked by you. If you like me, I'm a good person. If you hate me, I'm a bad person, right? My good feelings about who I am stem from receiving approval from you. So I need to hear from you that I'm a good person. I can't tell myself. So, it's kind of like, hi, John, how are you? Good. Well, how am I? Right? You need to tell me. Your struggling affects my serenity, right? My mental attention focuses on solving your problems and relieving your pain. So if I'm filled with anxiety, if I'm filled with problems, if I'm filled with pain and I don't know how to handle it, this is called vicarious displacement. What happens is I see you sick. What I have to do is I have to care for you. By caring for you, right, I now can care for the sick person, you, and I can care for me through you. And this is one of the problems that I have with addictions counselors. And I hope you're not one of them. Okay. Many people in recovery that do addictions counseling are codependent caretakers. And I don't want to hear that as an excuse, at least from my students. If you're a codependent caretaker, you better get yourself into psychotherapy before you touch a patient, because that, in my opinion, is extremely unethical. And I will fight that to the end. Okay. So this is why I say watch out for your transference and countertransference in a session. Transference, if you don't know what these two words are, all right? Transference is the patient's feelings, emotions, affects, and problems displaced onto the therapist. Okay. You remind me of my father. I hate you. That's a transference. Countertransference is the therapist's feelings because they can't handle what the patient is saying or are triggered by what the patient is saying. And they have affect and they have their own feelings, and those feelings are transferred onto the patient, or there's a transference of a countertransference of a flippage where the therapist now becomes the patient becomes the therapist. For example, you know, um, so what is it about you that reminds me of your father? Well, when you talk like that and you sound angry, well, my father was so angry with me. Yeah, I know exactly what you're talking about. Whenever I used to talk to my dad, man, he used to get angry at me too. I could say anything and he would get angry. Doesn't that just drive you nuts? I mean, I knew it drove me nuts. Your countertransference is kicking in. At that point, the session is over. All right. In another class, I'll teach you how to deal with that, but this isn't the place for it right now. So you got to be careful of that if you're a drug and alcohol counselor. You've got to have your own stuff, well taken care of. If your stuff isn't taken care of, you can't treat somebody. You really can't, because the countertransference is constantly going to come up, and you're going to see the switch. There's oh, I know one of the things that I always pick up when I'm supervising students is when they turn around. I'm listening to them carefully in session, group or individual. And they say something like, "Oh, I know exactly how you feel." Oh, you know exactly how they feel. Basically, what you're saying is, "Oh my gosh, I feel that way, and I felt that way." Nobody knows exactly how you feel, and please don't say that to a patient. You may think you know how they feel, but the best thing you can say to them is, I can relate to that in my own way. Tell me more. That way, your countertransference is in check and you're realizing that you're getting triggered. But to sit there and say, I know exactly how you feel. Let me tell you what happened to me. There you go. You just bought into the countertransference. And that's part of codependency. So I want you to be careful of that. Here are some characteristics of a codependent caretaker, right? My good feelings about who I am stem from being like you. Your behavior is dictated by my desires, and I feel you are a reflection of me. I'm not aware of how I feel. I'm aware of how you feel. Now, these things don't have to be um, overt. This can be how you're feeling in the unconscious, right? I'm not aware of what I want. I ask you what I am not addressing. I am not aware of anything. I assume dreams I have for my future are linked to you. That's really bad when that starts to happen. Because when that starts to happen, especially in a therapeutic relationship, you are now right on the cusp of a major ethical violation with the relationship with your patient. And a lot of times, the codependent, sometimes this stuff turns into sexual misconduct because you're feeling you're so uh, intuitive to the patient's feelings, and you're feeling the patient's feelings so intensely, and it hurts you so much, and you see that it hurts them so much, that what you want to do is you want to rescue them from their pain. But as you rescue them from their pain, you're turning over and you're thinking that what you're doing is the right thing. For example, a patient cries in your office and they're really emoting. We call this catharsis. They're really cathartic. And what they're cathartic about is something that's triggering you. And you're starting to get very emotional inside and you almost can't hold back the tears. So what you do to self-soothe is you sit there and you say, "You look like you need a hug. Can I give you a hug? You know, let's give me a hug. This will help you." And then you get into a hug, and then they start to cry on your shoulder, and you're still holding them, and you give you tissue, and then you rub their back, and then you sit there and you might kiss them in the cheek, rub the forehead, and say, "Let's talk about this. It's okay." And the next thing you know, one thing leads to another, right? Very bad, very bad. So be careful of that. You can't really go get into them. My fear of rejection determines what I say or do. So your patients are going to tell you sometimes, especially the border ones, that you suck. Plain and simple. You're the worst therapist they've ever had. You can't base your own practice on that. Right? The patient is allowed to be sick. That's what they're there for. You can't be. So if a patient sits there and tells you you suck, you're terrible, who do you think you are? That's not it. You're not even listening to me. Learn how to deal with that. Okay. Here's a good one. I value your opinion in a way of doing things more than my own. The quality of my life is in relation to the quality of yours. I mean, this is caretaking. I mean, you're like this with the person. Right? So when things like this come up, feelings, events, thoughts, catch it. If you hear a person in a session talking about and saying, well, the reason why I've got to care for Bill and my family is because I'm right there with him and I feel for Bill and I feel with Bill and my life is Bill, and all this stuff. My kid's 20 years old. He's my life. Better be on his own. Um, So the idea is to watch that. Another thing is low self worth. Let me give you some characteristics of low self worth in a caretaker, right? Um, they're coming from troubled, repressed, or dysfunctional families. They deny the family was troubled. They deny the family was repressed. They deny the family was dysfunctional. They feel a lot of guilt. They have a lot of shoulds. You should do this. You should do that. They wish good things would happen to them. And with others, they would like to love them. I remember in Philadelphia, there was this comic strip in the Philadelphia Inquirer when I was growing up. It was called The Born Loser. Everything that can go wrong went wrong with this person. Everything. I mean, he would screw up at work. He would mess up at home. Um, just anything. He is the kind of person that would drink a cup of coffee and didn't notice that the glass was broken. And as he would start drinking the coffee, it poured down his chest. I mean, this it was just terrible. As you read the comic strip, it's funny, but that's what a codependent caretaker with low self worth says. Nothing. I'm so bad. I'm terrible. I'm not worth anything. This can be very, very bad, and on so many different levels. This can lead to suicide. What happens with the codependent caretaker that has a low self worth is they project that low self worth aloud, and sometimes through their physicality. Slumping of the shoulders, looking really bad, always sad, or droopy. Constantly wiping their tears off and all that stuff. And you have the sick person trying to always soothe that individual. Oh, mom, it's not that bad. It's okay. Oh, Billy, don't worry about it. I've been through that too, and we've been through this together, and that type of stuff. It's not really good. Some of it is depression. Some of it is a manipulation, uh, but it's a low self worth, low self esteem, poor self image. People be very good codependent caretakers because what winds up happening is they take that material and they consciously or unconsciously, and sometimes they don't even know they're doing this, but the patient, the identified patient in the family, the drug addict, the alcoholic, becomes the caretaker. The caretaker becomes the patient. So that keeps the drug addict and the alcoholic sick, very sick, because they fail at taking care of the caretaker. And the more that they fail at that, the more they themselves have a low self esteem and a poor self worth. And when that starts to happen, their drug addiction starts to go through the roof. And then they go into recovery, and it takes a very long time to get out of it. So, another characteristic of codependency is repression and oppression. Let me give you a couple of those. First of all, the repressed person. A repressed codependent. They push their thoughts and feelings out of their awareness because of fear and guilt. So if you have your codependent person, right, that's in the household with an addict or an alcoholic, and they're starting to feel terrible or depressed or angry or something, they want to push those thoughts and whatever they're feeling inside out because they don't want that person to see that they're human. So what they'll do is they'll deny it, and they'll always come out as being bubbly and wonderful and happy and cheerful. And the patient thinks everything is beautiful in its own way. And if I'm like them, and what happens with the codependent caretaker that happens to be repressing feelings is they become symptomatic in a pathological way. Anxiety disorders, borderline disorders, sometimes paranoia. Sometimes, if they have been abused or traumatized as children, the dissociative properties come up, and multiple personalities are seen. They become afraid to let themselves be who they are. So, basically, the repressed codependent um, is afraid to really get to know who they are. And what they try to do is identify themselves in the sick person in the house, to the addict. So they look at the addict because they've repressed everything, buried everything, and they try to find something. If I can care for this person, that makes me a good person, because they're so confused about who they are. Again, very symptomatic of the borderline. They appear rigid and they appear controlled. So the repressed codependent individual that in the family system or in the session appears very much, I've got this. I don't need your help. If you listen to me, you'll find out that this is the right way to do things. Right? Um, they're repressing their feelings. You crack that repression. You try to get into that repression, which you don't do. You send this to a psychologist or a psychiatrist. Because if you get into this and you crack it open, you're going to have somebody get suicidal very quickly. You better know what to do with that, right? So if you notice these things, I would make this a referral and sit there and say, well, it seems to me like there's some stuff that you're dealing with that we can't deal with here. I'm not really sure what it is, but I've got a referral for you. I want you to go see, Dr. Karatov, right? He's a good psychiatrist, and I think he can help you with this. What I'll do is I'll get a release of information so that both of us can work together. But I really think you need to deal with this. Try to convince the person. Now we deal with the characteristics of the codependent that has obsessions. Here are some of these. They feel terribly anxious about problems and people. They worry about the silliest things. They think and they talk a lot about other people. They lose sleep over problems or other people's behavior. That's a biggie. They worry. They never find answers. They check on people. They try to catch people in acts of misbehavior. They feel unable to quit talking, thinking, worrying about other people or problems. This sounds a lot like OCD, right? They're obsessed with something. A lot of obsessions, that's basically what it is. So, unlike the OCD, the obsessed codependent, right, when they start digging and they start looking for problems, they're looking for problems to fix themselves, right? Not because like the OCD, they're obsessed because they think that something is they forgot to do something, or they have a repetition compulsion to do things, right? They do this because they need to keep themselves in check. They need to keep themselves in control. They need to keep their sickness where it is. So what they do is they take their feelings on the inside and they project it outward, and that's where the obsessions come in. Because notice these obsessions that I'm listening to you aren't things like, did I shut the gas off? I need to, lock and unlock the door 3 times and tap my shoe before I put it on my foot. That's a little bit of a different type of compulsion. They focus all their energy on other people's problems, right? So with the obsessive person that has OCD, they don't necessarily obsess on other people's problems. They can, but they don't necessarily do that. They more obsess on things that they themselves, more of a personal thing, have not done or did they do, or thought loops. You know, driving down the road and all of a sudden I turn back because I don't remember if I shut the gas off. Very classic. So I go back in the house and shut the gas off. And find out the gas isn't on. And go, glad that's not done. Go out and drive my car down a couple more blocks. Did I shut my gas off? I know I went back, but is it? Let me go back and check again. Compulsion to do that. So we see with the repression and the obsession of the codependent uh, caretaker, the codependent. One of the things with codependency, this type of behavior keeps the people sick, keeps them very sick. They're controlling. They're in denial. Right? The codependent has to control other people. They will sit there and they will tell the person that they've lived through the event over and over again. They know how to deal with things that are out of control because they were out of control at one point. They become afraid to let other people let other people be who they are and allow things to happen naturally, right? You've got to do it my way. This can also be a sponsor. You got to be careful with sponsors that come up and sit there and say, I've been sober for 20 years. I'll be glad to be your sponsor. And if you do things the way I tell you exactly, I guarantee you'll be sober. You get somebody like that, run like hell. Get, Thanks a lot, but I'm going to find another sponsor. Because that person is very codependent. That person is going to be very rigid. That person will sit there and everything that you say, well, I went through that, and this is what I did to get out, and you have to do this and this and this and this and this. If you want to relapse, go ahead and get that type of person because that will drive you nuts. And what they will do once you relapse is sit there and say, you didn't listen to me. That's why you relapse. Now you've got to listen to me because they need to be empowered. Instead of taking that power and giving it to you, they need to be. They get frustrated. They get angry. They feel controlled by events and people. If they're in denial, codependent that is in denial, right? They ignore problems or pretend that they're not happening. And you'll see, this with the teenager that's a drug addict, and there's a party. The mom and dad are down there, and oh, where's Johnny, your son? Oh, Johnny's upstairs. He's been good today. I just wanted to do his play his computer games, or he's upstairs studying. When Johnny's upstairs getting high, right? It's not happening. Or the one where all of a sudden the teacher calls up and sits there and says, "Well, we have a problem. Your son Mary, your daughter Mary Jo. We found some drug paraphernalia in her locker." Oh no, not my son. Mary Jo doesn't do those things. Mary Jo's a good girl. No, somebody must have planted them there. In total denial. Sometimes those codependents that are in denial can't take what's bothering them inside and look at it. It's painful for them. So what happens is they take that pain and they feel it, but they can't really name it. They work. They become workaholics. So the more they work, the less they have to deal with what's going on inside them. So they're codependent on work and they become workaholics. They can overeat. It's like, and there's another addiction. So can you be a codependent in an addiction, or you just have to be a codependent caretaker? No. Codependency also comes within an addiction. You know? Sometimes people that are drug addicts and alcoholics are big codependents. And they believe the lies. They believe that everything is okay. Or they believe that you're okay, when in actuality you are not okay. Oh, I found, pot's okay. California pot's just fine. Don't worry about it. It's legal. It's still a felony. So it's not okay. So, controlling and denying patients. Now we have dependency. Codependents are also very dependent. They don't feel happy. They don't feel content, peaceful. They don't feel these things within themselves at all. They're very agitated inside, lots of anxiety disorders. They look for happiness because they don't have it within themselves. So they seek it vicariously in somebody else. I can take care of you. And when I see you getting better, that's great. The problem is if you get better all the way, you're not going to need me anymore. So if you don't need me anymore, I'm useless. I'm worthless. So now I go back into my depression. So stay sick and let me help you. And then when you start to get better, that's great. But just stay sick, okay? They latch on to whoever or whatever they think can provide happiness. Right? So you're in a relationship. This is another thing with a codependent relationship. If I'm a miserable person and you're always happy, and when I'm around you, I'm happy. I want you. I want to be in this relationship with you, and we get this relationship. Whenever I'm around you, I do anything to make you happy because when you're happy, I'm happy. The moment you're not happy, I'm miserable and I'm a bad person. Imagine what happens when you get married, right? oh, I just love you to death. And, you do the huggy kissy thing, you do the sex thing, you have a kid. Oh, look, it's our beautiful baby. Oh, isn't he or she just absolutely gorgeous? Oh, yeah. So they start to care for the kid and together and all of that stuff. And all of a sudden, tensions in the family happen. Oh, I'm sorry. I'm sorry. What did I do? It's my fault. It's totally my fault. Oh, what can I do for you? What can I do that for you? And eventually, what happens is you've got one or the other parties that just take it, never give. That gets old awful. And then the tensions build. Well, you never do anything, right? What do you mean I never do anything? Well, you never do anything. You don't clean the house. You don't do the dishes. You don't clean the bathroom. You don't talk to me anymore. You're constantly on your phone. This type of stuff. When that starts to happen, the tensions start to build. Distance happens in the relationship. When distance happens in relationships, the codependent caretaker is not very happy. And then they try to do things to make the party happy. Once the party is happy, then the codependent becomes happy. Everything comes back into balance or sync, which in actuality, it is not in balance or sync. It's skewed. So they identify themselves, if I can make you happy, I'm happy. You're miserable, I'm miserable. So they mirror that other person, right? So if you have a drug addict in the family and a codependent caretaker, and the codependent caretaker is taking care of that drug addict, when that addict stops using, that codependent caretaker feels really good because that person is happy. What can I do to keep you not using? What do you need? Let's go to the movies. Let's go to the movies. Okay, let's go. All right. What do you want? Oh, I want to, tonight for dinner, I want a nice big steak. Nice thick juicy steak. Oh, great. Any type? Yeah, let me have a T-bone. Oh, I'll go butcher right now and I'll get one. You want it? Yeah. You don't use. Oh, I'm not going to use. That's great. What else? You know, close relationships, boyfriend, girlfriend, husband, wife. You don't love me anymore. Oh, yes, I do. Let me show you. How are you going to show me? Oh, let's have sex. Oh, okay. Really? The other thing, poor communication. That's the biggie. Poor communication. Blame, they threaten, they coerce, they beg, um, they blame. You know, um, they abuse physically, sexually. They try to say what they think will please people. Crowd pleasers. They try to say what they think will um, provoke people to get some type of reaction out of them that they can take care of. They talk too much. They talk about other people a great deal. The gossipers take things off for themselves. Look at how bad so and so is. They want to express that their opinions until they know that other people buy into their opinions. They don't know how to have a give take conversation. They don't know how to have a relationship with others. And because they don't know how to have a relationship, their communication skills break down. Sometimes you'll get the silent codependent. The one that will just listen. This one is going to be your group, your the person in group that is as the silent patient. And then when you try to engage that patient, you say to the person, "So, Bill, do you have anything to say?" "Oh, no, no, no. I'm okay. I'm doing good. My things. I just like to listen, and I absorb everything when I'm listening, and then I'll take that and I'll put it into practice." Well, Bill, I would really like to hear you contribute. Well, I really don't, but I'll try. Okay, just give me some time. I'll try. And then you go back to them throughout the course of the group if it's a 90-minute group. And now, after about the second or third time, they're starting to get a little agitated. I told you I like to listen, just leave me alone. I pass. And then they become silent, and that's it, and you lost them. They may or may not come back. But when you see that, that's what you may be looking at. You may be looking at the codependent that has very poor communication skills. So, if you have one or two people in the group that you notice this way, or even in your individual sessions, have a communications group or two. and have the other people in the group, have the other members in the group help you out. You don't have to be the one that lectures all the time. Do dyads. Teach about communication skills. Give a little lecture on communication skills for about 10, 15 minutes, and then break them up into pairs. Make sure pairs, not pairs, PAIRS. Make sure that you break them up into pairs and have the one with poor communication skills hook up with one with communication skills and have them switch. That will work them. Weak boundaries and lack of trust is another thing that is a hallmark of a codependent. Very weak boundaries. Say they won't tolerate certain behaviors from other people. Why? Because they can't tolerate it themselves. If they see it triggers them and now they're out of control. And the codependent's got to be in control. Gradually increases their tolerance until they can't tolerate and do things they said they would never do. They let others hurt them because that way, if you can hurt me, that's okay, just so long as you like me. It's attention seeking. They need the attention, and even a positive punishment for the codependent with weak boundaries is something that they could understand. They wonder why they hurt so badly. They've repressed so many feelings, so many emotions, that they are in terrible pain and they hurt tremendously. And because they hurt tremendously, they just don't understand why. It's like, I'm always hurting. What's going on? And again, that gets buried more confusion comes on. They start to have racing thoughts. So now the pain that they have turns into an anxiety disorder. And then that pain comes in, and then they start getting distracted. And that distraction turns into an obsession or a compulsion. And that obsession and compulsion turns into poor communication skills, and it just worse and worse and worse. Um, they get angry. They become intolerant. They lack trust. They don't trust themselves, their feelings, their decisions. They don't trust other people. They try to trust unworthy people, just because they don't like not being right. They think God has abandoned them, and they lose faith and they lose trust in God. It's lack of trust. Anger. Anger is a big thing with codependents. They feel very scared, very hurt, and very angry most of the time. They live with people who are very scared, very hurt, and very angry. They join with that anger and pain. It latches onto it. So now they have to, uh, the other person gets angry, they get angry. There's no healing. It's just a constant battling. This causes abuse. This is trauma. This is what I'm talking about. This is a complex trauma. They're afraid of their own anger. They are frightened by other people's anger. So they're kind of scared of their anger, and they're also afraid of other people's. They don't know what to do with it or how to handle it. They feel controlled by other people. They repress their anger. They think other people make them feel angry, and that's something I want to talk about. You make me angry. You make me feel hurt. Every time I talk to you, I feel abandoned. Whenever I see you, you make me feel disgusting. You make me feel fat. You make me feel ugly. Okay. Let me tell you something. Words are very powerful. Words hurt. They do. You have to understand that principle first, that words hurt. Number one. However, you make me feel. No, you can't make me feel anything unless I give you the power to make me feel something. Let me say that again. You can't make me feel anything unless I give you the power, unless I empower you to make me feel that way. Can't. You can't hurt me. You can't get me angry. You can't tell me I'm fat, I'm ugly. That won't hurt me, right? You can't tell me My mother wears army shoes and drives a Mack truck. Unless I allow you in my mind, in my heart, within me, if I allow you to hurt me. Tony, you're an ugly son of a gun. Really? You want to see how ugly I am? Come here. Oh, don't you ever say that to me again. Yeah. Um, it's anger. It's built up anger. Right? And if I have to react to that anger, what am I really reacting to? You? I'm really reacting to the anger within inside me that I can't control. So therefore, what you're saying is hooking me. Carl Jung may call this hooking the shadow side of the personality, hooking you. And as I'm hooking you, an affect or an emotion arises from that hook. And once an emotion arises from that, I react to that emotion. I allow myself, I give myself permission. I love you. Okay. Oh, I love you too. Let me see what I can get from this person. Okay, tell me I love me so that I can be manipulative and get this and this and this and this and this from them. Do I really love you? No. I'll use you, but I won't love you. How many people have ever felt that way? That's codependency. Oh, she loves me. Oh, he loves me. And that can be very dangerous because if you got the person that thinks that way, right? Um, I'll tell you a little story about that in a few seconds. That could be deadly. I had a patient one time. This is when I was very new into mental health treatment, and I was doing psychotherapy on this guy who was a drug addict. It was back in 1989, 1990, somewhere around there, 1991. And I was treating this person, and he was a heroin addict. He was a Vietnam vet out of Vietnam, really messed up guy. He was diagnosed with um, I think it was schizophrenia and a psychotic depression, something like that. And he had a girlfriend, very beautiful woman, and she loved him, and he loved her. They were just shooting up together, doing what drug people do, doing heroin together, and he'd be doing pot, and he'd be drinking. He had a gun, and he would threaten her every now and then whenever he wouldn't get his way, and she would buy into it and give him what he wants, so he wouldn't shoot her and everything else. So one day, treatment went on for a couple of years, and I had him, and the clinical director had her. And one day she calls me up, Tony, can I talk to you? And I said, sure, come on in. So she comes in. I told the clinical director, who had her, because we were sharing notes. I said, she wants to talk to me. He said, okay. She said, yeah, go ahead. So she said, I want to thank you for helping me and helping him. I said, you're welcome. I said, what's up? She goes, I'm leaving him. She says, I can't take it anymore because I'm tired of walking into a situation where I'm feeling my life is threatened. I'm in danger. Whenever we have sex, he's high. I don't want to use anymore. And I'm finding myself that whenever he starts drinking or starts using, I want to use and I'm staying away from it. So I'm done. I've had it. I said, bravo for you. And then we talked about what she was going to do. Next day or so, he comes in, angry as hell. And I said, what's the matter? He's leaving me and tells me the story. And I'm like, well, and then he says it. She can't leave me. I love her and she loves me. She can't leave me for somebody else. And I says, what if she does? I'll kill her. Well, when I heard that, I immediately went into Tarasov mode and wanted the 5150. Well, we call it 5150 out in Philadelphia. It's called 302. I wanted to involuntarily commit him and all this stuff, and he wouldn't hear it, he wouldn't say it, and anything else. I was ready to call the police. Um, just got messy. Um, he eventually killed her. If you want to see the case It's online. Just type in Tony Scuderi or Anthony Scuderi and PCHD or PCHD versus Emmerich, Emerick, and up will come the amicus brief case that I had. Um, it went all the way up to the state Supreme Court because they were suing us after he killed her. They tried to sue me, tried to sue the agency, they tried to sue psychiatrists who passed away. Uh, at that point, we won, and the reason why we won is because I followed through with Tarasov. Documented like there was no tomorrow. I tried to commit him. The boss said, no, you can't commit him. And at that time, Philadelphia did not have a Tarasov law. And we were not bound to contact the police or contact anybody else if somebody made a threat. The way it was. So he threatened her. I didn't really have to do anything, but I did. Lucky. I knew about Tarasov. So went to that point, and the judges sat there. It was a nine court judge, and 7 of the judges said no. 2 of the judges said that I could have done more. And then when I started to read the brief, I called up the attorney and I said, why didn't you mention this and this and this? Because that's what they wanted. He said, oh, it was irrelevant. I said, what's irrelevant? I said, I got 2 judges that dissented. He says, it's all right, because it doesn't matter because you and the company are free. But this is what a codependent's anger can do, right? He defined himself by her whenever she sat there, I love you, or whenever they had sex, or whenever they did something. That's how he defined himself. The moment that fell short, that's what happens. Sex problems. It's another thing. Care dependent co-takers or codependent caretakers are in the bedroom. Tell me how you want it. Tell me what you want. It's a good thing, right? I think when you have sex, it's a very important thing that you somewhere along the line communicate. Tell your partner what you need, what you want. But do it in such a way where you're both comfortable. Okay. Sometimes people are not comfortable. Want a blowjob? And all of a sudden the person gets freaked out. Um, let's have sex. I don't like that word. What do you do? You need to talk about these things. Um, when you are in that type of relationship, right? There's certain things that are comfortable and certain things that are not. Certain things that turn you on, certain things that turn you off. And it's not just taking your clothes off and laying there with somebody of the same or opposite sex that you're attracted to. Your verbiage. It's how you say things, right? You don't always ask, tell me what you want. How do you want it? What do you want? Would you like this? Would you like that? That's okay now and then. But what about your needs? Are your needs getting met? Or the person sitting there saying, well, I want to do this to you. I'm going to tie your arms up to the bedpost and tie your legs and have rough sex with you. Okay, go ahead. Or the person gets really nasty and it turns into a rape situation. Or an abusive situation, right? If you're uncomfortable with something along those lines, a healthy person will sit there and talk. Please don't say to me, let's have sex. Say to me something a little bit more gentle. I want to make love to you. Okay. Some other people may sit there and say, just ask me, you want to have sex? You comfortable with that? Yeah, okay. All right, fine. Some people get lewd. I'm not going to let your mind go on that. This is a video. I'm not going to use those words. But, some people may, let's F, right? Other people get very turned off by that, but it can cause sex problems, right? What if your codependent relationship, sex relationship comes in with, what if somebody wants to do something to get their own jollies, and it's not comfortable to you, the other person, and the other person just sits there and says, okay, go ahead. Well, you know what can happen there? First of all, that's abuse. And then the other person may not know that, but it's abuse. And that person can dissociate. And that's not good. The other thing is, as it says here, they lose interest in sex, make up reasons to abstain, which the sex partner would die, go away, or sense the codependent's feelings, have a strong sexual fantasy about the other person, and maybe not acted out on that person, or um, their codependency, their issues of not wanting sex makes them more appealing. So now we have the chase, right? Considered, or they have extramarital affairs um, because of the oppression of the other person, or even the other person may not want to have sex. So if there's not a trust relationship in there and it's not understood, we don't want to have children or whatever the case may be, this is where a lot of cheating comes in. Also, the idea of the other person holding back and the other person wants it. And, I don't want to have it tonight. And then the other person placates. Well, okay, fine. That's healthy every once in a while. But when it happens often, more and more and more, now we have problems. We're human. We're wired for sex. We're wired for this stuff. For the codependent, I want to make you happy any way that I can. For the other person, that could be the greatest thing in the world. For the codependent, that could be the worst thing in the world because they're not getting their needs met, and eventually just can't do it anymore because it's a lie. And then you've got the miscellaneous parts of it. I'll give you some miscellaneous things. Be extremely responsible or irresponsible. Think of the codependent that's responsible. I'll do everything for you. Just tell me. Or the irresponsible one. I'm not going to do a damn thing. So therefore, I get your attention. You tell me to do it. I'm not going to do it. They find it difficult to have fun, to be spontaneous. This is the one that goes out on a date and, oh, honey, you want to go on a date? Yeah. Where do you want to go? Oh, I don't know. Where do you want to go? Oh, wherever you want to go is fine with me. Well, okay, but what would you like to do? Whatever you want to do. And you have the circular thing that they'll eventually, you're 3 hours later, they're going, so what are we going to do? All depends on what you want to do. You want to do something? Yeah, let's do it. Okay, what do you want to do? I don't know. What do you want to do? Oh, boy, here we go again. Have an overall aggressive response to codependency, violence, anger, or dominance. So the person knows the other person is codependent, right? And they're codependent as well. So the codependency is hooking on one another, and they're going to sit there and they're going to argue with the other person. When you stop doing that, you're codependent. No, I'm not. You are. No, you are. And now it gets into a fight. I'm codependent. You're codependent. Would you like to be codependent too? Codependence. Makes a nice song. Then you have your classics, passive aggressive responses with one another. So the codependent person can be very passive aggressive. They get the other person angry at them if that's where their codependency lies, or the person's not giving them what they want. So therefore, they're going to be passive aggressive to get the message across to that person that they're angry with them, so that person um, who they are saying that they're angry with tries to do things for them to abate their anger. And now they're not angry anymore. They're happy because they're getting their needs met by that person. Now that codependent person is happy because now they're getting their needs met by the other codependent person who is angry. How the circular thing works. Progressiveness. Codependency is a progressive disease. It just isn't always there. Um, how does this codependency progress in a person? How can you recognize some of these things? Well, some of the telltale symptoms, if a person is lethargic all the time. Now, also, we have some medical issues here to look at. could be something different. So physical evaluation might be at hand. But lethargic, depressed, feeling depressed all the time. So lethargy and depression go hand in hand. Now, it doesn't mean that somebody's lethargic or depressed that they're codependent. No, they can have a major depression recurrent, a simple depression. They can have a chemical imbalance, it could be a thyroid issue. It could be a whole bunch of stuff. They could become withdrawn. They could become isolated. Again, it could be part and parcel of depression. All right. Abuse or neglect their children or other responsibilities. This can lead into alcoholism. This can lead into more depression. You know, these all the things that can happen. So you're going to see a dovetail. Why it's so important for you to understand psychopathology, to understand DSM-5, to learn DSM-5, right? Even though you can't diagnose, this is one of the reasons why you have to be able to diagnose, because you're going to see these things and you're going to say the person's depressed, they're lethargic, they're not eating, they're sad around their children all the time, they're neglecting their children. Oh, they're depressed, they're codependent, right? But there's other things that happen. They can feel hopeless, right? If they start to feel hopeless, that's bad. That can lead to being suicidal, right? We all feel helpless now and then, and that's fine because we can always get help from other people. Oh my God, I feel helpless. I just don't know what to do. And then you talk to somebody and you work together with somebody, and now you don't feel helpless. Right? Uh, when you feel hopeless, I was thinking of an example, and when you feel hopeless, hopeless is different. Hopeless is the bottom of the barrel. In hopeless, there is nothing that anybody can do for you or you for you. It's a sense of being empty. It's a sense of nothing happening. And now we're borderlining on suicidality. When you have a patient that sits there and says, "Oh, what do you like to do? I used to like to golf. I give my golf clubs away." Oh, did you give anything else away? Well, yeah, I got some nieces and nephews, and I had a coin collection. I'm getting too old to collect. I don't really, want them anymore. So I gave them away to them. And all of a sudden you start to see that they're starting to do stuff like that. That's a red flag. That person needs help. That person, you want to hurt yourself? No, 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 no. I'm not going to hurt myself. Now you got to make determination, because even though you dictate, no, you note person states they are not suicidal or homicidal. At the end of every session, you should do that. Ask them, on you want to hurt yourself or anybody else? No, no, I don't. But if your gut is telling you in deep inside, I don't trust this, don't trust it. Person states they are not suicidal or homicidal, but their behavior is such that this therapist does not trust that self-diagnosis. The person is giving away all the things that they used to enjoy doing. They're giving away their golf clubs. They've stopped doing music. They've given away their coin collection. They've given away this. They've given away that. They've stopped eating. They're not sleeping right. And they're lethargic. Right? I'm going to 5150 this person if they do not want to be a voluntary commitment to the hospital. I believe they are suicidal. And then 5150 them, get them in the hospital. If at that point the hospital kicks them out, that's on the hospital. That's not on you. If the person kills themselves at that point, that's on the hospital. If you don't do that and the person kills themselves, right, and you didn't catch it, even though you documented it, there may be something there. Be very careful. Begin to plan their escape from a relationship they feel trapped in. They think about suicide. They become violent. They become seriously emotionally, mentally, or physically ill. They experience an eating disorder, either overeating or not eating. They become addicted to alcohol or other drugs. Codependent. So to wrap things up with this, it's a very serious thing. We all talk about codependency. We all sit there and say, "Oh, you're a codependent." And if we don't know why a person does something, they're codependent. No, they're not. And maybe, yes, they are. But you really have to probe into what's happening. And again, I'm telling you, pick up these two books, Codependent No More and Beyond Codependency, and read them for God's sake. These are two excellent books. I had some students in the past when I taught this class that said, "Oh, geez, I read the material and it just wasn't enough. Could somebody please explain codependency?" And I talked to them for a while and gave them these two books. And I told them, please pick them up. And they picked them up. And by the end of the class, within about the third week, they called me back and they sat there and he says, Doc, this is wonderful. Thank you so much. And they went on the posting board and they posted information from both of these books, and it turned out really well. So please, a couple things that you need to do before we close this. Number one, look at yourself, look at your own behaviors, look at what you're doing, see how you make yourself happy, how you make other people happy. See how many times, if you're talking to somebody, how many times you get hooked and how the session switches. Be very aware of that. If you are a drug addict or an alcoholic, get yourself help. Just because you're in recovery doesn't mean you're recovered. People believe that you are. You're not, right? Get the help that you need. If you do understand, and this does ring true to you, that you are a codependent, there is help out there. Get a good therapist, not a drug and alcohol counselor. I'm talking about a psychotherapist. Get a psychologist. Social work is okay, but get a psychologist. Because we know how to work this a lot better. Okay. If you're in a family situation, MFTs are just as good. Social workers are just as good in a family situation, right? If it's individual, I would do a psychologist or psychiatrist thing. If you're in a family situation, social worker, MFT. That's just my personal opinion. I got nothing against MFTs or social workers, but I think that they each have their own position, just as a psychologist does, and just as so. You don't have to be codependent. You can be beyond codependency if you want. And you can also be codependent no more if you want, but it's your choice. So I hope you got something out of this. You have a PowerPoint attached to it. Review the PowerPoint, and I wish you well. Take care and keep up your good work. I like what I see. All right. Bye.